Liver, especially in China, of course, liver is the holy organ. You don't want to mess with the liver. You might as well throw your medical license away because patients want to make sure the liver is okay. And it is not so strange that we have created this confusion, because when we started with statins and we monitored liver changes, we saw in some patients that they went up, the transaminases, and that was a signal to stop the statins. But what we've learned over, and listen, we've been using statins for almost 40 years. There's more than 300 million patients using statins. We know everything about statins in terms of safety. What they found out, it's the opposite. Patients with liver problems actually improve when using statins. The amount of fat that is stored in the liver is starting to go down. And the ones who start with the statin with high transaminases go down. So that means some of the hepatologists are now using statins in patients with liver disease to support other types of treatment. And last but not least, which patient do we see most frequent with liver problems? We call it now MAFLD and MASH. Patients with metabolic syndrome and diabetes, right? And those are the patients at the highest risk of developing cardiovascular disease. So as a doctor, you think, oh, maybe I should not give a statin because that might harm the patient and the liver. But you forget you're harming the patient much more serious by withholding the statin. Last but not least, we are now actually advised when we start the statin to measure transaminases. If they're normal, do not measure them again. And the reason is, if we measure them again and they're slightly elevated, which is not unlikely, we get confused. Patient get confused. Well, if we don't measure them, unless there are signs, and transaminases are not so sensitive to pick up real liver cell problems, we can just continue using them and see how patients fare. And the chances of really having a toxic reaction in the liver is 1 in a million. 1 in a million. Yeah, so definitely use the statin in that population. So I had, and then last but not least, the new onset diabetes. I think I addressed that already a little bit. Statins don't cause diabetes. Let's be quite clear about it. Statins do have a slight negative effect on glycemic control, but I'm always surprised that patients can drink a whole bottle of Coca-Cola and then may complain about the fact that they use a statin that might develop diabetes.